So as Dr. Kekana said, this journey has started in 2005. It's really been 7 years. And my senior colleagues sitting in the back, Nate Berger and George Kekana, travel with me every year, at least once, back to China and work on this. And I was really happy to see this come to its fruition. So it's really my honor to have the opportunity here to present the CWRU Case West Reserve University School of Public Health, School of Medicine, Global Health, the China Initiative that focuses on population health research and medical education. So here's a cartoon. So probably a lot of you have seen this before. This is the picture from data from US CDC showing the obesity rate changes from 1985 through 2010. So the red and orange band showing that in each state, if the obesity rate is over 25% or more, and it's saying that since 1985, actually do it again, so it was in blue and gray. Now the whole country now covered, more than half of the country now covered by orange or red. So I'll recap this. Basically, that's a trend of rising pandemic of obesity happened in the United States. This is 1990, then 2000. That's 2000. The axis cut off 2010. Now you look at the whole country across 50 states. More than half of the state now has obesity in adults. More than 30% of the adult population are obese. So obesity is a well-known risk factor for cardiovascular disease and diabetes. Actually, for the last 10 years, as much of the work we do in Case West Reserve have contributed to the concept that obesity is also a risk factor for cancer, including colon cancer, breast cancer. Well, now obesity is definitely a pandemic now in the United States, as well as most part of the West country. But unfortunately, China has not been immune to this. We think that Asia and China actually mainly deal with infectious disease. That's not the case anymore. So here's a picture of a Chinese boy. And actually the data published in Lancet, the very high-profile journal showing that the rising of child obesity, China has the steepest slope among all the nations. And since child obesity now is on the rise dramatically in China, and you think about those folks, 20 years, 30 down the road, diabetes, heart disease, cancer, and everything will come. And actually, he's eating Kentucky Fried Chicken, and well, the gene has not changed, right? Our Chinese has our gene has not changed in the last 20, 30 years. But what happens is really the urbanization, the economic development in China, and now this is a side effect from that. The westernization, as you can see, actually, this is actually picture in Beijing. Kentucky Fried Chicken now kind of downside in the United States, but this business booming in China. If you go to Shanghai, and actually I remember in 1990, I left China, came to USC for a PhD study. The last meal I had was a farewell party for my friends. It's a Kentucky Fried Chicken in Tiananmen Square. That's a big treat, right? It's a big treat to treat you a Kentucky Fried Chicken as a farewell party for you to go to the United States. And the people lined up actually to get a Kentucky Fried Chicken. So the lifestyle in China is really changed dramatically. It's changing lifestyle and has caused a lot of problems. And it's really due to the westernization, urbanization. So in China now, chronic disease are actually recognized. Cardiovascular disease and cancer are now the #1 killer in China as well, especially urban China. And actually data showing that from 1997 to 2007, breast cancer and colon cancer increased by 50% in both in Beijing and Shanghai data. And the type 2 diabetes now has reached 9.8% prevalence. In a sense, 1 out of 10 Chinese adults has diabetes. And that's probably underestimated because China does not do a screening program. It's what diagnosed diabetes now at 9.8%. And actually now the World Health Organization estimates that China has the most number of diabetes in the world, surpassing India.